Welcome everyone, Dr. Lindy here. In today's lab, we're going to be looking at the axial musculo system, right? When we covered muscles, we learned it axial and appendicular. We're going to cover muscles the same way. So we're going to look at the muscles first of the head, the neck, the torso, and then we'll do another lab where we'll do the upper extremity, and then we'll do another lab that has the lower extremity. So let's look at the head first and look at some of these terms. Some of them can get a little bit confusing. They have some, redundant words in them when we compare muscle to muscle. So let's look at some of the larger, more obvious muscles of the neck first, right? So what we see right here, very superficially, is a muscle called the platysma. Okay, this is the platysma muscle, and when you do this with your neck and you try and lift like your lower chin up, you can actually raise and wrinkle your neck muscles. That's the platysma right here. Then there's another muscle that runs in this direction. It's just deep to the platysma, and we call it the SCM, but you can't abbreviate on your labs. So the SCM stands for Sternocleidomastoid, SCM, Sternocleidomastoid. And this muscle is given its name by its origin and insertion because it originates on the sternum and the clavicle. This is the sternal division here, and this is the clavicular division here. This is on their left side of the neck. This side is on their right side of the neck, but still originates on the sternum and clavicle, and then comes on up here and inserts on the mastoid process. That's the sternocleidomastoid. Right above the ear, we have an Auricularis. And this one right here, it's blocked out for some reason. This is called the Frontalis. Okay. The frontalis, or the frontal belly of the occipitofrontalis. I think they may label that one on another picture. Let me just see if they do. Okay, so this is either the frontalis or the frontal belly of the occipitofrontalis, because there's a muscle that goes from the occiput over the cranium right to the frontal bone. So either frontalis or frontal belly of the occipitofrontalis. Going around the eye, around the orbit, is the Orbicularis oculi. Orbicularis oculi. Now there's another Orbicularis around the lips, Orbicularis oris, Orbicularis oris. Underneath that bottom lip, let's see if I could zoom in a little bit right there. Right here, Depressor labii inferioris. So labii, or labii, means lip. So depressor labii inferioris. It depresses the lip inferiorly. But there's one here that goes to the angle of the mouth, right here in this direction, and that's a depressor anguli oris. Depressor anguli oris. This green line right here, going to the side of the mouth this way, is called a rhizorius. The rhizorius. Now, there was a depressor labii inferioris. There's going to be a levator labii superioris right here. So what's the opposite of depression? Well, that would be elevation. Depressor, levator. Labii, labii, superioris, inferioris. So they're somewhat antagonistic to one another. So there's a levator, labii superioris, and then there's a depressor, labii inferioris. One's underneath and one is above. Make sure I covered everything here. Okay. Now, when we zoom in here on the face, right here, this gland is called a parotid gland. That's your parotid gland. And just anterior to the parotid gland is this muscle that runs up and down like this, and that's called the masseter. The masseter is one of your muscles of mastication. Mastication means one of your chewing muscles. So this is one of your chewing muscles. Then right here in this circle, it's a little bit deep, there's a muscle called buccinator. This is like the trumpet muscle. When you puff your cheeks out like a blowfish, that is the buccinator muscle. And then near the mental foramen is a muscle called the mentalis. The mentalis. Again, masseter, deep into this circle right here, buccinator. Remember, buccal means cheek. And then mental is chin, like the thinker. That's the mentalis. Along the temporal region is the temporalis, right? The temporalis originates on the temporal bone, and then it comes down underneath that zygomatic arch and has an insertion site on that mandible. Okay, so again, that's one of your muscles of mastication. From the side view here, we can see this individual's left sternocleidomastoid, sternal division, cleido, clavicular division, mastoid process. And the way the SCM works, that this sternocleidomastoid, which is the person's left SCM, when it contracts, it's going to rotate their head to the opposite direction. It's going to turn their head to the right. So the left SCM turns their head to the right SCM will turn their head to the left. The sternocleidomastoid also laterally bends the head, so the left SCM can laterally bend the head to the left, bringing the left ear to the left shoulder. Here's the masseter that's cut, right? Otherwise, it would go up in this direction. But this is the one of the insertions of the masseter on the lower jaw. From the side view here, we can see the upper trapezius muscle. Right here is the trapezius. Now, inside the neck here, we're going to cover these muscles as well. They're called scalene muscles. And there's an anterior scalene, a middle scalene, and a posterior scalene. And we can see them here. 1, 2, 3. Anterior, middle, and posterior scalene muscles. Right here, this is the Pectoralis Major muscle, Pectoralis Major. And around the shoulder, this is the deltoid. And the deltoid has 3 divisions to it. It's a large muscle that gives the rounded contour of the shoulder joint. So 3 divisions would be 1 in the front, 1 in the back, and 1 on the outside. 1 in the front, 1 on the side, and 1 in the back. So the fibers in the front, we'll call it the anterior deltoid. The fibers in the back, posterior deltoid. And the fibers on the outside are the middle deltoid. So you have an anterior deltoid, a posterior deltoid, and a middle deltoid. And general rule of thumb is the limb is going to move in the same direction in which the muscle is located and in the same direction as the fibers. So the anterior deltoid is in front of the shoulder. It's going to pull the shoulder forward. The posterior deltoid is behind the shoulder. It pulls the shoulder backwards. The middle delts are on the outside, so it brings the shoulder outside. Now we just have to know the names of the actions. When you pull the shoulder forward, that's called shoulder flexion. When you bring the shoulder back, shoulder extension. And when you bring the shoulder outwards, it's shoulder abduction, abduction. Flexion, extension, and abduction, or shoulder abduction. Okay, so here from the front view, we can see the platysma muscle nicely. We can see the sternocleidomastoid here and the sternocleidomastoid here. And you can really see the sternal division, and you can see the clavicular division of the sternocleidomastoid here. You can also see the upper fibers of the trapezius, the upper traps right here. If we look at the nose right here and the lips, levator, labii, superioris. What would this one here be called? Depressor, labii, inferioris. And then right here, mentalis. And right here in the nose, going across, nasalis. Mentalis, nasalis. Mentalis, nasalis. Around the shoulder, because it's the front, we would call this the anterior deltoid. Here on the side, middle deltoid. And what we can't see on the back, posterior deltoid. Superficially in front of the chest, Pectoralis Major. Now, if there's a pec major, wherever there are majors, there's always minors. There's a major, there's going to be a minor. That holds true with teres major, there'll be a teres minor. Zygomatic major, there'll be a zygomatic minor. Rhomboid major, there'll be a rhomboid minor. Wherever there's majors, there are always going to be minors. So pectoralis major is superficial. See, there's a little tab here on the pec major, and if we were able to pull that tab off, what we would see deep to it would be pectoralis minor, and I'll be able to show you that in another picture. Let's take this head and let's rotate it to the posterior now. Now we're looking at the skull from the back. Here's the spine, here's the left scapula and the right scapula. Now on the right half of the spine and the left half of the spine are going to look a little bit different. And the reason being is on the right-hand side here, there's a muscle that has not been dissected or deflected away. And it is a muscle called the trapezius muscle. So here, where I'm pointing here, this is the lower fibers of the traps. These are the middle fibers of the traps, and these are the upper fibers of the trapezius. So the trapezius muscle is fully intact on the right half of this person, but on the left half, it's been dissected away so that we can see the muscles that are a little bit deeper. So again, on the right-hand side, we can see the upper trapezius, the middle trapezius, and the lower trapezius. The upper trapezius is going to elevate your scapula. The lower trapezius will depress the scapula, and the middle fibers will adduct the scapula. Adduct means to bring closer to midline. So because these fibers run horizontally from left to right, if here's the origin and here's the insertion, it's going to move the scapula medially. And that's scapular adduction, also known as scapular retraction. Okay, now once the trapezius has been dissected, now we can look on the left-hand side. And just deep to the trapezius in the neck is a muscle called the Splenius Capitus. Okay, Splenius Capitus. Capitus, capital means the head. So it's going up to the skull. That's the Splenius Capitus. Now, when we deflect the trapezius, we can see two muscles going from the spinous processes of the thoracic vertebrae to the vertebral border of the scapula. And going from C7 and T1 spinous process, going from the C7 and T1 spinous process, origin, and inserting here on the medial border or vertebral border of the scapula is this muscle called Rhomboid Minor. Now, I said before, wherever there is a minor, there's going to be a major. Inferior or underneath or inferior to Rhomboid Minor is going to be Rhomboid Major. Rhomboid Major goes from T2, T3, T4, and T5. It goes from T2 to T5 spinous process, T2 to T5 spinous process, and that too runs to the vertebral border of the scapula, aka medial border of the scapula. Notice the angle of these fibers are a little bit on a diagonal. They're not perfectly horizontal like the middle fibers of the trapezius were. These are more on a diagonal, and it makes the shape of a rhomboid or a rhombus. So there's a rhomboid minor and there's a rhomboid major. Minor goes from C7 to T1 spinous to the vertebral border. Rhomboid major goes T2 to T5 spinous process to the vertebral border. Now the rhomboids are going to retract the scapula. They retract or adduct the scapula. But they just don't do that because if you look at these fibers, they're a little bit on a diagonal. They run like from superior to inferior on this diagonal. So when it adducts, it also takes the scapula and rotates it downward so that the inferior angle moves up and that superior angle moves down. It's going to kind of rotate so that the glenoid cavity is pointing downward. So they call it downward rotation of the scapula. The glenoid cavity is the reference point whenever you hear upward and downward rotation. If the glenoid cavity is pointing down, it's downward rotation of the scapula. If the glenoid cavity points upward, it's upward rotation of the scapula. So the rhomboids adduct and they downward rotate the scapula. Okay, if you remember when we did osteology, we learned the spine of the scapula. And the spine of the scapula was an important landmark because there's two fossas, one above and one below. The fossa above it is the supraspinous fossa, and the fossa below it is the infraspinous fossa. And when I taught you osteology, I said there's going to be some rotator cuff muscles that originate there. The one that originates on the supraspinous fossa is the supraspinatus muscle, and the one that originates on the infraspinous fossa is the infraspinatus muscle. Both supraspinatus and the infraspinatus are going to share the same insertion site. They're both going to insert onto the humerus where the greater tubercle is. So the supraspinatus and infraspinatus, although they originate different places, the insertion is on the greater tubercle. Okay,